Hello, my name is Darian Thomas, and I am currently a student midwife. And as a student midwife, it is my responsibility to educate my clients on healthy pregnancy and childbirth practices. And today's video is dedicated to hygiene and pregnancy. Welcome to part 1 of my series in client education. Today's topic in hygiene and pregnancy is going to address dental, breast and chest, vaginal health, and the prevention of infection through hand washing. Physiological changes happen in pregnancy that sometimes result in noticeable change in things like your oral cavity. Various changes happen to your gums and teeth during pregnancy, so it's very important to, of course, always clean and floss your teeth daily and stay up to date with your normal routine dental care, like going to the dentist. Bottom line, good oral health keeps your gums and teeth healthy. That way you can prevent things like pregnancy gingivitis, lesions, and toothaches. Moving on to topics like your chest and breast. Daily bathing is adequate, but be sure not to use soap on your nipples, especially being that these physiological changes are causing things like colostrum to start to leak from your breast, and you don't want any unnecessary chemicals to get in there and affect your lactation. Soap can also dry the skin and crack the nipples, causing that area to be vulnerable to things like infection. Washing and drying with plain water is sufficient, and using some natural moisturizer like coconut oil in that area can be sure to keep that area clean and healthy. We are now going to discuss cleanliness of the vagina during pregnancy. First, remember to put nothing in the vagina. No soap, no douches, nothing but water. Water is key and essential to cleaning the vagina. Cleansing products can irritate the skin and cause infection. What about the vulva, the outside area of your vagina? Never aggressively clean the outside area of your vagina aggressively. That can cause dryness, irritation, and discomfort and swelling to the area. Water, again, is the best way to clean your vulva, the outside of your vagina. There are some instances where a fragrance-free, sensitive, very gentle cleansing is needed in that area, for examples after sex or after a cycle or after having a baby. For clarification, it is not essential to use a cleanser on your vulva area, but for people with incontinence issues or after having a baby or after a cycle, a gentle, natural, fragrance-free cleanser could get the job done. You also want to be careful with using cleansers and different chemicals in that area because it can change your pH balance, and we all know that pH balance imbalances can cause things like yeast infection, and your body is more prone to things like UTIs, yeast, and other infections during pregnancy. So please use water and be gentle in that area. And because you are more prone to different infections and diseases during pregnancy, it is very important for you to know how to wash your hands and good hand washing practices. For example, using an antibacterial soap when washing your hands and cleaning that allows for enough time for the soap to sud up and bubble up, and for you to rinse it thoroughly, getting every area, including under the nails, and drying effectively. Good hand washing practices includes washing your hands upon leaving work, when you come into your home, before and after eating, and sneezing to reduce the spread of upper respiratory infections like the flu and COVID-19. So yes, wash your hands, cover your mouth, and just pay attention to the environment that you're in and the people that you're around. That way you can be aware of things you may be exposed to. Thank you very much for watching this video. And again, I am student midwife Darian Thomas. This is the first episode of my educational series, and thank you again for watching. I hope you learned something.